So in this session, we will go through vaccine storage and cold chain. Just remember, almost all the vaccines are stored at temperature of 2 to 8 degrees centigrade. Just remember this temperature. Almost all the vaccines are stored at the temperature of 2 to 8 degrees centigrade. And we have to preserve this temperature from the manufacturing to the site of vaccination. So the steps that we take to ensure that the vaccine is being properly stored and transported at the correct temperature from the point of manufacturing to the site of vaccination, this is termed as cold chain. So cold chain is an important aspect that assures the quality of the vaccines. So what are the various steps in cold chain? So it contains walk-in freezers, walk-in cooler, then again it is transported into deep freezers for storage, then ice-lined refrigerator or the ILR, where it is stored in hospitals, PHCs, etc. Then cold boxes, day carriers, that is used for transport to the site of vaccination. So these are the various parts of the cold chain. Just remember them. And this thing you have to remember. These three. These are the major important things. The first one is the heat sensitive vaccine. So what are the heat sensitive vaccines? The most heat sensitive vaccine is the OPV, followed by measles and BCG. The OPV, measles, and BCG are the heat sensitive vaccines. So if these vaccines get exposed to heat, this will get damaged. So these are the heat sensitive vaccines. So what are the freeze sensitive vaccines? And the freeze sensitive vaccines include all the T vaccines, or the vaccines that contains T, such as pentavalent, DTP, TD, TT, hepatitis, etc. These are fondly termed as the T vaccines. The pentavalent vaccine, DTP, TD, TT, and hepatitis are the freeze sensitive vaccine. And what are the light sensitive vaccines? Light sensitive vaccines are measles and BCG. Measles and BCG. Since these are light sensitive vaccines, these are usually comes in a amber colored bottle. Amber colored bottle. So that the light will not go through the bottle. So it comes in amber colored bottle, the measles and BCG, and the heat sensitive vaccines, OPV, measles, and BCG. Among the heat sensitive vaccine, and the OPV has a peculiarity that it can be frozen. So this is a favorite question. So which among the vaccine can be frozen? And the answer is OPV. The OPV can be frozen. Okay. So these are the major questions that are being asked: the heat sensitive vaccines, the freeze sensitive vaccine, and the light sensitive vaccine. So coming to the storage in case of an ice-lined refrigerator. So this is a ice-lined refrigerator, ILR. So here the lid will be at the top. So the T vaccines will be at the top. Since these are free sensitive vaccine, it will be at the top. So the hepatitis B, the Penta, the DTP, the TT, TD, etc. all will come on the top. And in the bottom, it will be OPV, measles, and BCG. So just remember, in the ILR, the OPV, measles, and BCG will be on the lower side. And on the top, it will be the T vaccines. Just remember the T for top. So this is regarding the placements of vaccine in the ILR or the Iceland refrigerator. Just remember this. And one more thing that you have to know is regarding VVM. What is VVM? It is a vaccine vial monitor. So the vaccine vial monitor, it contains a circle inside which there is a square. Okay. So usually the square will be lighter. The square will be lighter normally. What does it indicate? So it contains a thermosensitive material. Thermosensitive material, and its color changes based on temperature and time. Okay, the color changes based on temperature and time. If the vaccine is being subjected to a sufficient temperature over a sufficient time, and the color will change. So the VVM indicates whether heat damage has occurred or not. So when can we use? Use if inner square is lighter. Not to be used if inner square is same or darker. So if the inner square is same or darker, the VVM indicates that the vaccine should be discarded, that the heat damage has occurred. If the inner square is lighter, then we can still use the vaccine. So how will you know whether to use the freeze sensitive vaccines? We can use what is termed as the shake test. Shake test. So this is another important question. Which test is used with respect to freeze sensitive vaccine? The answer is shake test. The answer is shake test. So that is regarding the cold chain and the vaccine storage. Coming to this session, it is catch-up immunization. What do you mean by catch-up immunization? If a child comes without taking vaccines according to the national immunization schedule, so then we can give what is termed as the catch-up immunization. Either the child has missed some dose or child is not vaccinated at all. Not vaccinated at all. So we should go through some principles. That principles we have already mentioned. In case of any two separate live vaccines, you can either give them simultaneously or 4 weeks apart. In case of live vaccine, two different live vaccines, I already mentioned. In case of two different killed vaccines, you can either give them simultaneously or there is no interval between them. Okay, that is the major principle. And you have to know the cutoffs. Cutoffs for vaccine or the upper age limit. So in case of BCG, it is 1 year. In case of OPV, it is 5 years. Then the DTWP or the DTAP, the cellular pertussis, or it is less than 7 years. If a child of 7 to 10 years come, we can give DTAP followed by TD and TD. Sorry, TDAP followed by TD and TD, 0, 1, and 6. Okay. So just remember that in less than 7 years, only we can give the DTP. In case of more than 7 years, we have to give TDAP at the first and then followed by TD and TD at 1 and 6 months respectively. That is regarding BCG, OPV, and DTP vaccination. Then rotavirus, the upper age limit is 1 year, but according to the CDC, it should be completed within 8 months. 14 weeks is the upper limit for the first dose and 8 months for the last dose, according to the CDC guidelines. That is the US guidelines. The rotavirus, the first dose should be given before 14 weeks and the last dose should be completed within 8 months. But in case of national immunization schedule, according to the universal immunization program, the UIP, it is still 1 year. UIP, it is still 1 year. So these are the major upper age limits that you have to know: the BCG, OPV, the DTP, which is less than 7 years, the rotavirus at 1 year. Suppose previous year question, it was like this: 13-month-old infant, unimmunized, came to you. What are the vaccines that you will administer? So the options included BCG, measles, DTP, rota, measles, BCG, DTP, measles, OPV. So what is the answer? Since the child is 13 months, both BCG cannot be given and the rota cannot be given. And as a result, the answer is DTP, measles, and OPV. OPV can be given till 5 years of age. It is still 7 years, can be given. Okay. So this is regarding how the questions will be asked regarding the catch-up immunization. Also, one more question is there. Child with a wound. Unimmunized. So what will you give? So here you should give tetanus toxoid. And in India, recently the TT is being replaced by TD. So you can give TD. And if the wound is not clean, then you have to give tetanus immunoglobulin. Tetanus immunoglobulin, the dose is 250 international units. 250 international units of tetanus immunoglobulin if the wound is not clean. Okay, so that is regarding the catch-up immunization. I hope you have understood. So just follow the principles and know the upper limit. So BCG, the upper limit is 1 year. The rotavirus, the upper limit is 1 year. And the OPV, it is 5 years. And the DTP, it is 7 years. And with this, you can solve all the questions regarding the catch-up immunization.